Thank you for joining us for our special webinar tonight. Please get settled in, and I will be introducing our guest speaker this evening, a Medicare expert, Tom Manner. Tom is not only a personal friend, but a veteran of 35 years in the field of Medicare. And he specializes in helping make Medicare a seamless and straightforward decision for his clients. For all those who have pre-submitted questions for tonight, Tom has done his best to incorporate these into his presentation. James will monitor the chat box tonight for any further questions, and Tom will attempt to answer a few of those as time permits at the end of his presentation. If your question is not answered, feel free to reach out to Tom himself or a member of the APC team at the conclusion of this webinar. Thank you, and without further ado, Tom Manner.
Good evening. As Joe said, I am Tom Manner, and I hope tonight's presentation will give you a better understanding of Medicare and the types of Medicare insurance offered. Just a reminder, this event is only for educational purposes. No plan-specific benefits or details will be shared. Medicare is an insurance program not unlike your employer group coverage or your private health policy. It helps pay for covered health issues, and like most private policies, Medicare is a shared expense plan. You can elect to purchase additional insurance to cover some of the cost of Medicare, what it doesn't cover, or you can leave Medicare and have private carriers provide Medicare Advantage plans. When do you sign up for Medicare? Medicare has three basic groups of people: people age 65 or older, people under age 65 with certain disabilities, and people of all ages with end-stage renal disease. For today, we're going to assume you're in the first group. Most people enroll around their 65th birthday. You can enroll during the 3 months before your birth month, the month of your birth, and 3 months after that, giving you a 7-month initial enrollment period. Depending on when you enroll, coverage can start as early as the month of your 65th birthday. If you miss that initial enrollment, you can sign up during the general enrollment period every year between January 1 and March 31st. If you enroll at that time, your coverage is effective July the 1st of that year. Under certain circumstances, you may be eligible for a special enrollment period. If you have questions about that, please contact me after the program. If you're still working and covered under employee group insurance, you can either enroll in Medicare and drop your group coverage, or you may be able to delay enrollment and stay with your employee program. You need to compare your plan at work side by side with your Medicare coverage and decide which is better for you. Before deciding to leave your employer plan, always discuss all of the options with your benefits administrator or insurer or plan provider. In most cases, once you leave, you cannot return. So how do you sign up for Medicare? If you're collecting Social Security, enrollment in Medicare is automatic, and you will receive a card in the mail 3 to 4 months before your birthday. You can also call your local Social Security office if you have any questions. If you're not collecting Social Security, you can enroll in Medicare 2 different ways. First, you can call the Knoxville Social Security office at 833-597-0084 to schedule an appointment around 100 days prior to your 65th birthday. I'm told by that office that appointments are usually phone appointments, and all of that's because of COVID still. If you're not in Knoxville, search for your local office telephone number. You can also sign up at ssa.gov/benefits/Medicare/. If you contact me, I can send you an email with the telephone number and the enrollment link. The original Medicare program was signed into law on July 30th, 1965. Former President Harry Truman and his wife were the first beneficiaries. Today, over 56 million Americans are enrolled in the Medicare program. That's most Americans age 65 and older, regardless of their income or health status. Original Medicare has only two parts, A and B. Part A is for the hospital care, and Part B is for medical services, which includes doctors. Let's start there. Once you enroll in Part A and Part B, you can rely on the basic coverage or purchase supplemental coverage for additional protection. There is usually no premium for enrolling in Part A, but Part B has a premium, which we will discuss later. Again, Part A is for hospital care. It covers things like your hospital room, meals, general nursing, and hospital services and supplies while in the hospital. It does not cover private duty nursing, comfort, or convenience items. Coverage is up to 90 days per benefit period, and the first 60 days are covered at 100% after the Part A deductible is met. You pay an out-of-pocket cost for any days after 60. There's an additional 60 days of coverage called lifetime reserve days, but it can be used only once. It's important to note that the deductible is $1,556 and applies to any new benefit period. So if you go into the hospital for a couple of days, get discharged, and then return a week later, you will still be in the same benefit period and will not be charged again for the $1,556 Part A deductible that you incurred on your first confinement. If you are out of the hospital and skilled nursing facility for at least 60 days in a row, a return to the hospital would begin a new benefit period, and you would owe a Part A deductible again. Part B is optional. It covers things like doctor's visits, lab work, and x-rays outside of a hospital. It's an 80-20 plan, meaning Medicare pays 80% of the approved expenses, and you are responsible for the remaining 20%. The premium for Part B starts at $170.10 per month per individual, and it can be higher depending on your income. There's a $233 deductible, but the deductible is for the whole calendar year, not per occurrence. If you collect Social Security check, your Part B premium will most likely be deducted. Part B is required to enroll in a Medicare supplement or Medicare Advantage plan. This chart shows that if you are a single person with an income of $91,000 or less, or a married couple with an income of $182,000 or less, the premium is $170.10 per month per person. That covers a lot of people. However, depending on your income, you could pay an income-related monthly adjustment called IRMA, which is currently based on your 2020 modified adjusted gross income. This also applies to Part D premiums. If you have a life-changing event that reduces your income, you can submit Form SSA-44 to your local Social Security office. You can download the form from ssa.gov or I can send it to you if you will contact me. This form has instructions, but I suggest that you contact the local Social Security office for assistance. This is also mentioned on the form. You will probably need health care beyond your hospital and doctor. For example, Part A and Part B do not cover things like dental, vision, hearing, and the big one, prescription drugs. We'll address that later. For now, just remember that Part A and B don't cover everything. Now, where do you go? Did you enroll in Part A, or do you want to enroll in Part A, Part A and B, Medicare Advantage, or even a Medicare supplement plan? Or do you want to continue with your employer group health coverage or possibly union coverage? Note, you may also have an option of retiree coverage for health care after you retire, but it does not count as credible coverage for delaying the enrollment in Medicare Part B, and neither does COBRA. First, if you have the option of continuing on an employer group health plan, a union plan, or retiree plan, you will want to compare it to Medicare A and B. Medicare suggests that you talk to your employee health benefits administrator and ask these questions. Are there copays and deductibles? Does it include a drug plan? If I opt out, can I opt in later? What is the cost? Does it include dental and vision coverage? Just remember that retiree coverage for healthcare after you retire does not count as credible coverage for delaying enrollment into Medicare Part B, and neither does COBRA. If you want to explore Medicare supplement insurance or Medigap, there are lots of options. You must have Medicare Parts A and B, and then purchase a Medicare supplement policy to cover certain costs that Medicare does not. There are 10 federally standardized Medicare supplement insurance plans that are offered in most states, plans A through N. Plans C and F are only available to individuals who were age 65 prior to January 1 of 2020. These plans are offered by many different insurance companies. Here's what's important. All Medicare supplement plans contain the same basic benefits, and all plans with the same plan letter provide identical coverage for medical expenses no matter where you buy them. Plans have the same standardized benefits for each letter category, only the premiums may vary. Your policy may have a different cost depending on the insurance company, but still has the same coverage. Here's a list of the 10 standardized Medicare supplement plans. The most popular plans offered by most companies for individuals aging into Medicare are plans G and N. Plan F is still popular for individuals that were 65 before January 1 of 2020. There's also a high deductible version of Plan G that is not listed here. There was a plan asking what Plan G covers. So if you look at the chart, you'll see that Plan G covers everything except the Part B deductible. And it does cover 80% on a foreign travel emergency. When is a Medicare supplement the best path? A Medicare supplement can help you pay for gaps in Medicare coverage. It helps you if you want to budget your medical costs, or if you travel often, or you may need to see someone other than your hometown doctor. If you want healthcare coverage for things outside of Part A and B, like vision and dental, you can purchase additional insurance coverage. Medicare supplement policies are guaranteed renewable as long as you pay your premium. Medicare Advantage is another option. Medicare Advantage requires that you have original Medicare Parts A and B. It provides coverage through provider networks, also called HMOs, PPOs, and MSAs. Medicare Advantage Part C basically replaces Medicare Part A and B and can include coverage for Medicare Part D. The key benefit is that Medicare Advantage plans include a maximum out-of-pocket feature to help you control cost. This cost can vary by plan. And when is Medicare Advantage the best path? Medicare Advantage is good when you like the network of doctors in your area and want to pay a lower premium. Medicare Advantage is a good idea if you're a veteran and use VA services, or if you have a low income subsidy for Medicare. Now let's look side by side at a comparison of Medicare supplements and Medicare Advantage plans. Medicare supplement is an age-based premium plan, and Medicare Advantage has a flat premium regardless of age. They both have deductibles, co-payments, and co-insurance. Part D is not included with a Medicare supplement, and Part D plans are available separately for purchase, called standalone Part D. Medicare Advantage plans may include Part D prescription drug coverage, and the ones you will probably buy will be called an MAPD. Standardized plans for Medicare supplements are A through N. Benefits with Medicare Advantage plans vary. A Medicare supplement is accepted by any Medicare provider, and a Medicare Advantage uses a provider network. You can change Medicare supplement plans at any time during the year. You can change Medicare Advantage plans during limited enrollment periods. You may have to answer health questions if you're not in Medicare supplement open enrollment or a guaranteed issue period. Medicare Advantage has no health questions, and a Medicare Advantage may require additional prior authorization for services. So what's a Medicare supplement open enrollment? It's a 6-month period starting the month your Part B is effective and lasts an additional 5 months. During this period, you do not have to answer health questions. If you enroll in a Medicare Advantage plan when you are first eligible for Part B and then want to enroll in a Medicare supplement, you will have to answer health questions after your Medicare open enrollment ends, unless you have a guaranteed issue period. If you enroll in a Medicare supplement when you're first eligible for Part B, you can disenroll and enroll in a Medicare Advantage plan, because Medicare Advantage plans have no health questions to answer, but enrollment periods may apply. Now back to prescription drugs. Part D covers prescription drugs. Think D for drugs. Part D can be standalone or part of a Medicare Advantage plan. Drug cost and plan premiums vary by plan. Part D may or may not be part of an employer group plan, a union plan, or retiree coverage. Late enrollment penalties may be imposed if you do not sign up when first eligible or do not have credible coverage. Veterans are not required to enroll in coverage, but may choose to do so. Okay, prescription drugs. You may have heard of prescription drug plan, GAP, or donut hole. What that means is that if you require over $4,430 worth of prescriptions during a year, you will pay a higher part of the cost. In other words, your plan covers the first $4,430 of drugs as usual, but then from $4,431 to $7,050, which is the donut hole, you pay 25% of brand name drugs and 25% of generics. Then once you hit $7,050 in out-of-pocket expenses. Catastrophic coverage begins, and you will only be responsible for a small copay or co-insurance for drugs purchased during the rest of the calendar year. These are the amounts for the 2022 plans and may change for 2023. Okay. I know this is a lot to take in, and you'll want to take some time reviewing all the different options. I really appreciate y'all listening to me tonight. I hope it was a beneficial presentation. I know that Medicare is confusing. It's the reason I have a job. So please contact me with any questions, whatever it is. And I really appreciate you attending tonight, and I really hope it was beneficial. And thank you very much.